Today, I will tell you 10 untold facts about immunotherapy which you have never heard, but you must know. Well, if you look into cancer, advanced stage cancer is still a deadly disease even today. There has been a lot of research in cancer that has been happening for last 100 to 200 years. For example, in lung cancer, a lung cancer patient used to survive for 3 months 50 years back. With the advent of chemotherapy, it increased from 3 to 6 months, 6 to 9 months, and up to 1 year. The increment in survival with these cancers was only minuscule, small increments. But with the advent of immunotherapy, which is the greatest discovery in the field of cancer till date, has improved the survival even of a terminal cancer to 5 years. For example, today we are seeing patients with even an end stage lung cancer easily surviving 5 years. We had never seen a lung cancer patient living so long. So, immunotherapy, of course, undoubtedly, is the greatest discovery ever in the history of cancer. Second point, which you must know, cancer is definitely an immunosuppressive disease. Cancer suppresses our immune system, it weakens our immunity. So, to improve the immunity, we give something called immunotherapy. The other names of immunotherapy are checkpoint inhibitors, L1 blockers, CTLA4 inhibitors, anti-LAC antibodies, and so on. And these immunotherapy drugs are all injections which we give once in 2 weeks, once in 3 weeks, or once a month. Number 3, immunotherapy works not just in one cancer. It has got approval and it has shown success in more than 15 types of cancer. For example, skin cancer, lung cancer, kidney cancer, colon cancer, liver cancer. Every cancer, you can see some role of immunotherapy. Right. Point number 4, which you should know. Well, immunotherapy has really improved outcomes, no doubt. But unfortunately, immunotherapy does not work in all patients. It works in 3 out of 10 patients. Only 30% of patients get benefit from immunotherapy. Therefore, what we colloquially say is if someone is getting benefit with immunotherapy, we say he has won a lottery. It's a magic if immunotherapy works in you, but you need to fall in 3 out of 10 for it to work. It is very difficult to predict in which patient it works, in which patient it doesn't work. There are some biomarkers like PDL1, tumor mutation burden, MSI, and so on, but it is not 100% predictive. Number 5, if you look into surgery, radiation, or chemo, all these have limited duration of treatment. For example, chemo is something like 4 to 6 months, radiation is 1.5 months, but immunotherapy should be given for a long time, 1 year, 2 year, or continuously until the patient is alive or until the disease worsens. So, these medicines are given indefinitely on many occasions. Point number 6, if you look into treatments like chemotherapy or even targeted therapy for that matter, they work only for a brief period of time. For example, if I am giving only chemotherapy in lung cancer, it works for 4 to 6 months. After that, the cancer becomes chemo resistant and the disease worsens and you need to switch your chemotherapy molecule. But the responses to immunotherapy are durable. If there is a response, these patients are going to respond for 3 years and up to 5 years. So the responses with immunotherapy are long lasting and durable. Point number 7, which is very important. If you look into chemotherapy, for example, You keep giving chemotherapy, like fourth cycle, fifth cycle, and you stop giving it. The moment you stop giving chemotherapy, the disease is going to come back. But immunotherapy is not like that. You give immunotherapy, and even if you stop it in between, the effect of immunotherapy persists even after stopping it. This is the magic of immunotherapy. The immunity is activated in spite of stopping immunotherapy. The response, the benefit continues to persist. Point number 8. We all have heard of the side effects of chemotherapy: hair loss, diarrhea, low blood, and so on. But immunotherapy doesn't cause any of these side effects. Immunotherapy is very safe and easily tolerated. However, in 10% of patients, they do come across toxicities. We call it as immune-related adverse events like thyroid problems or colitis and so on, or skin problems, rashes and so on. What happens in immune toxicity is the immunity is so active that it starts fighting against our body. However, it can be easily managed. And remember one more thing, those patients who develop immune-related side effects have better control over cancer. So therefore, it is good to have immune toxicities. Point number 9. These drugs until today are not yet manufactured in India. They are all imported from international pharma. Hence, these drugs are extremely expensive. For example, a drug is a couple of lakhs every month, and it is not easy to afford. However, to help this, a lot of pharma have come with very attractive patient assistance programs. Like if you buy for 3 to 4 months or 5 months, the whole 1 year of treatment is free. So these have good measures so that immunotherapy is accessible to a lot of patients. And last point, point number 10. What we Indians have done to reduce the cost and to increase the affordability. Number one is we Indian companies have looked into production of biosimilars, and likely in 1 or 2 years we will see Indian companies manufacturing immunotherapy drugs, again which will reduce the cost and the accessibility will increase. And very important, another research we Indians have went into, we have understood that immunotherapy works even in a lesser dose. For example, 1/10 of a dose, immunotherapy is effective. For chemotherapy, you need to give full dose. There is a dose response curve. Like the higher the dose of chemo, the better is the effect. But immunotherapy is not like that. Even if you give 1/10 of the dose, immunotherapy is working. So we have went ahead and explored lower dose of immunotherapy. With this, we are able to again offer lower doses to a larger proportion of patients who cannot afford it. So these are the 10 untold facts which you must know. So if you have any of your patient or any of your family members with cancer, do contact your treating oncologist and ask of whether you're going to benefit with immunotherapy. Thank you so much for listening to me.